Thank you for joining us for today's episode of Tennessee Public Health for You. I am Kim Harrell, the Executive Director of the Tennessee Public Health Association and your host of today's episode. Tennessee Public Health for You is a series of podcasts designed for Tennesseans to help us all gain a better understanding of the broad and complex public health system, the people, places, and practices that come together every day to make our lives healthier and safer. Dr. Alvarado, thanks for joining us today.
My pleasure to be here.
Thank you.
Going to have a lot of fun.
Thank you.
Yeah.
Thanks. So, as a matter of kicking off our inaugural episode, would you please just introduce yourself to the audience and tell
Sure.
everybody about why you're here?
Yeah. So, again, Ralph Alvarado. I've told this story a lot, so I'll try to condense it to make it kind of compact for the podcast. But effectively, I'm a physician. I've been a practicing doctor now for, I want to say 28 years. Kind of came originally from California. My parents were immigrants to the country from Costa Rica and Argentina. They met in California, got married. I came along, went to high school out there, college down in San Bernardino, and med school at a small school called Loma Linda University. Met my wife. We got married, 3 days of honeymoon, and then right into residency at the University of Kentucky for internal medicine and pediatrics. Did my training there for 4 years. I tell people I got Kentucky-fied, fell in love with the area, and we stuck around and kind of put our roots down, started to practice, grew that into 2 different locations, and was kind of a good old country family doc. Basically wound up doing primary care, did my own hospital work, nursing home work, realized very quickly the impact that government had on healthcare. I was part of organized medicine in the Medical Association, and they had a bill that was coming up. They asked me to call my state legislator. I contacted the guy, and the guy didn't vote at all, and got me a little upset. I told my wife I needed to get more involved. I was at the office one day. Someone came by campaigning for someone running for office. My wife said, "By the way, my husband wants to get more involved." That person happened to be the local party chairman, who then called me, asked me to run for office. That started a journey that I didn't expect because I was never involved in the political world or anything along those lines. Ran for state house in 2004 and in 2006. Got beat both times, thought I was done. 2010, they said, come and run for state senate. Ran for state senate in 2010, got beat again. They said one more time in 2014, and my wife said, get it out of your system. We ran, we got in. And then once we got in, had about 10 years of pent-up policy and filed a bunch of healthcare legislation. And with the divided House and Senate, got a lot of things done. Was promoted to Senate Health and Welfare Chairman. Had a chance to speak at a national convention, which is kind of rare for a rookie, a legislator in the state in particular. And then also wound up getting asked to run for lieutenant governor with Governor Bevin in Kentucky. Met Governor Lee. We lost that race, but stayed involved in a lot of healthcare issues. And then last year, Governor Lee reached out and said, hey, I want you to consider coming and being Commissioner of Health here in Tennessee. We had a lot of other things we were contemplating that year. Didn't think it would work out, but they allowed me to maintain a little bit of a clinical practice. Came and interviewed, talked to a very good mentor friend of mine, asked him what I should do. And he said, you need to go do that. That's an automatic. All the innovation in healthcare is happening in Nashville. You've got a lot of out-of-the-box thinking. This is an opportunity to get a lot of good things done. And if you have an impact in Tennessee, it'll have a regional impact because everyone's looking to Tennessee to what they do. And so prayed about it. Everything opened up, and here we are, and kind of hit the ground running, I think, in the first 6 months. And had a chance to visit every county, every health department, all of our regional offices. We've got a great staff at the Department of Health and a lot of people very committed to improving health outcomes. So I'm excited about the task ahead, and I come with a lot of energy and a lot of ideas. So I'm ready to roll.
You do. And you have been doing that since you arrived in, was it January? Was that your official date?
January 16, yeah.
And since that time, I understand you have been to, have you gotten through all 95 counties?
All 95 counties, yeah.
That's awesome.
Yeah, every county, and it's in. Everybody tells me it's 3 states in one.
Yeah. Have you noticed that?
A little bit, but it's the hospitality's been uniform across the state. Everybody's been very, very friendly. I have to admit, in Tennessee, and very welcoming. A lot of very what's the word I'm looking for? I guess the desserts I've been offered and everywhere I've gone to have been incredible. I probably picked up a few pounds because I've been driving, not doing as much walking as I need to. But Appalachia's got its own feel, very similar to Eastern Kentucky. Really, Middle Tennessee is just gotten so populated. It's got a little bit of a different feel, and then Western Tennessee is a bit different. So it's been fun to experience that. I need to spend probably more time because I've gotten to go in and meet folks and talk to folks, but spending a lot of time there would probably get me that much more into the culture of it as well. But it is 3 states in one. Yeah.
Well, I would think that that's helped you too in terms of the public health system in Tennessee. And you and I have talked about this. I've talked about this with a lot of folks out in the communities myself. Public health is so broad and so complex that it's really not well understood. So how would you describe public health in general, just to kind of give everybody a little background, and then in terms of the system and how we work together, the 95 counties, and maybe even describe some of the services, which are very broad.
Yeah, so it's a difficult thing to define just because it's different probably in different states. And different states have different points of emphasis on what health will do, but typically public health is here really to, I look at it as more as prevention, right? That's how I've always focused on as a physician. You have health care, which is kind of active disease management and treatment, and then public health is more about prevention. Now, there are active things that we treat as well, because it is a very broad kind of focus, but we're here to kind of maintain the overall health, to try to create a healthier Tennessee so that people don't have to become sick and have disease conditions, to do proper prevention, to avoid disease. And we know that if, and that again, it has, how do you get there? There's a lot of things. We know that, poverty is linked into good health outcomes. And so if you can improve people's prosperity as well, there's only so much we can do. In our realm, we often depend on other departments to do that, to kind of achieve that success. But I've had a chance to meet all the different commissioners and explain to them that health impacts all of them. No matter what happens, we impact them all. But then also their success is what we rely on to achieve better outcomes. So I need transportation to do well. I need labor to do well. I need education to do well. All the different departments in state government. We're very broad. People often, when they come and work for us, when they first come in, they go, man, I didn't realize how much the Department of Health does, because we impact people's lives so they don't even know it. So if you go into a restaurant, you're going to presume that the food there is safe to eat and to consume. Someone's checking that for you. That's typically the Department of Health. We're going in to make sure that things are being done by certain standards. Water supplies. You think about just if people have any kind of sexually transmitted infections of any type, folks want some anonymity in that, and a lot of times they'll come to the Department of Health for that, and then there comes counseling on those things. We work on just better nutrition for the community. So we have programs like WIC, which is Women, Infant, Children, a huge program that we have to offer to let people be able to come in, often don't know that they qualify, to be able to get additional food and supplements for children. We know that if kids have adequate nutrition and proper nutrition, it avoids then down the stream things like obesity and other problems. And so a lot of that impacts with that. We do a lot of things also to help connect. Got a tremendous program called the CHANT program, which is like a navigation program for families in which we identify families at risk and help them navigate the system, which can be very complicated, to tie into better benefits for folks in terms of community things or things that states will offer to get their families, get them on better footing, and then again make them more prosperous down the line. You see this background of food. I mean, that's one of the things I want to focus on, is a lot of the social determinants of health that we talk about that impact health, that we often try to impact as well. So one of those is going to be food insecurity, which I'd like to, in the future, be able to focus on that 15% of the people in the state go to bed hungry. They don't know where their next meal is coming from. And when our state seal says agriculture on it, that's, there should be no excuse for us not to provide. I think people in this state are very generous, something I've learned very quickly here too, that folks are willing to bridge that divide and help people get them back on their feet. There's also a lot of pride in Tennessee. Pride for lots of things, for success, but then sometimes pride for not asking for help, which can be damaging too. And so we have to, again, find a way to reach those folks so they don't feel like they're having to ask for a handout, but we can give them a hand up and help them out. And I've got some ideas on how to get those things accomplished. Smoking prevention and cessation programs that we offer. We have also in the state of Tennessee a very unique structure in that we offer primary care. So we have the legislature has kind of deemed it to offer primary care. We have 56 different primary care clinics throughout the state, 16 federally qualified health centers, so that folks can come in, and if they don't have a doctor or they have a hard time getting to a physician, they don't have insurance, they can come to the Department of Health. We'll provide that care for you. Not all of them have it, but most of them do in the state. And so we bring in dentists to provide dental care, physicians and nurse practitioners to provide medical care, often can provide you medications for help or assistance, at least in getting those medicines if we don't have them. So again, very, very broad. We also, obviously, coming out of COVID, everybody relates with us vaccinations. And there are programs to offer vaccinations for physician offices. Those are getting very cumbersome for doctors to do, so less and less physicians are offering vaccines. And so to get those vaccines, kids come through our Department of Health to be able to get those vaccinations as well. And adults can get them. We talk about our flu vaccines, COVID vaccines, all the different types that are out there that we offer and provide folks for. So those are my mind as it just rambles. Those are the things that come to mind. So many things that we offer, so many programs that are out there that we try to help folks with, and again, try to navigate systems and provide opportunities for them just to get healthier. And we're looking at broadening those things, and all the while trying to look at groups that sometimes are the ones that are marginalized, don't have that opportunity. We try to reach out to them to meet people where they're at, to get them in, to give them the help that they need.
Well, in your mind's racing, it's reflecting the broad, the just immense scope of public health. And while you identified a number of things that are within your jurisdiction, so to speak, in terms of your responsibility in the Department of Health, it does extend into other areas, water and sanitation, as you mentioned. Right. And a lot of these discoveries in public health really only occurred within the past 100 years. And when you think about it, it's kind of been boring lately. In some way, because you had sanitation early, 1900s, you had smallpox vaccine and polio and those kinds of things. And really, COVID really was kind of an exciting time in terms of the discovery of vaccines. So, regardless, everyone should certainly have free choice and things of that nature. Sure. But the availability in public health, what you just described, enables folks access to those kinds of services, which is most important. I think one thing you touched on as well was the income. It's not just exclusive necessarily to particular income groups. A lot of what public health is offering extends to all Tennesseans.
Yeah, true.
And so when there is any kind of decision in public health, I think we all should take note that it could potentially impact us and our lives of our children and our families.
I'll tell you, I did a bit of volunteering, again, prior to coming to Tennessee, for a lot of food insecurity issues, and there was a chance that in Kentucky, one of the junior highs was having a food distribution for folks that needed it. And so they advertised it was just a drive-through so that you could maintain distancing. It was in the height of the pandemic. And some of the folks that came through there are folks that probably were of some lower socioeconomic status. There were some very nice, very fancy cars that came through those lines as well, of people that I knew what they did, but because the pandemic hit and suddenly economics suddenly shifted, they didn't have a lot of cash flow, and suddenly they were strapped. And so there's a lot of people that are very comfortable, obviously, and you think, oh, I'm comfortable, but in a moment's notice, things can go away. In a moment's notice, you look at Hawaii, fires that have gone through there, beautiful areas, very wealthy homes, suddenly all swept away, gone. People don't have anything. If they have an issue, a health issue, where are they going to go? They're going to go probably to their local Department of Health there to get assistance or help. Tennessee offers the same thing, that if when people are down and out, we often rally to help each other out. But where you go to get that health care or those health issues or solutions or where can I go and get this, we're kind of the clearinghouse where people come for information and for assistance in getting any kind of health issues handled or settled. And so we work, like I said, on so many fronts, and I probably have forgotten a bunch of the things that we go through that if you mention, oh yes, we do all these things as well, but it's just it's a broad department, a lot of very dedicated people that are working at different things, and we're again constantly trying to find ways to improve our outcomes and making really Tennessee a healthier place to live.
So the public health system in Tennessee, you've touched on it very well, Dr. Alvarado. But can you speak a little bit to the partnerships? Certainly the state of Tennessee has got their fingers in every county. But then you've got the metros, and then you've got the county mayors, and you've got other entities that also work with you. Can you talk a little bit about the value of that partnership and the importance of their roles?
Sure, yeah. So in particularly now, as we've come through, a pandemic where there were a lot of entities who would wag their finger at people and say, you need to do this, you have to do that. I think a lot of folks are turned off on those things. And so you have to get to the point where you're going to be able to motivate folks, from themselves, find whatever motivates them to kind of achieve better outcomes. When you have, again, higher levels of government that kind of push ideas to lower levels doesn't work well. You have to have a lot of these solutions happen locally. And we've got very active volunteers in every county. We have health councils of people that are just advocates in the community, and they come from varied sources within the community, but they meet, talk about what we need to do to get healthier in our community, in our counties. And I'd like to leverage more of that if we can. A lot of these health councils that we have, where people do an assessment of their county, make a determination of what we need to do to improve. What are the top 3 priorities that we have? And a lot of those are kind of across the board in most of the counties throughout the state. But then those also have to tie in your local officials who have to agree. Most of our health departments, the buildings themselves are owned by the counties. Traditionally, we often will help invest a lot of that, but to maintain a lot of those buildings. And so for a lot of them, they are very conscious of what goes on. And if we want to have kind of advocacy come to reality in those counties, we need to have buy-in from local government and from local organizations that are invested in those communities. Things are different, in what's going to matter in Nashville will be different than what's going to happen in Polk County, for example, or in Lake County, where they're very rural. They might have different needs. So what I want to do is be able to leverage that. There's going to be some general ideas of things that we could improve. And, we try to provide grants and investments for a lot of those organizations. So we need people that are willing to have those ideas or concepts to bring towards the Department of Health. And so we try to encourage that innovation to occur at a local level. And again, if people are motivated locally to do things, it's better than for us to issue a mandate from on high. We've also made a big effort to reach out to a lot of our churches and a lot of our faith-based organizations throughout the state to kind of provide a lot of connections there, because sometimes if you're wanting to promote certain healthcare ideas, if it's the government saying it, people automatically reject it. But if they hear it from a faith-based community that they're part of, where they have a lot of trust already, so we try to partner with them to try to see what we can work on together to advance certain public health causes, and to do it with groups that people trust in their communities and feel connected with. And then obviously I think there's an even broader opportunity for connection with our schools. I've had a chance to meet the new Commissioner of Education and talk to her really about some ideas and concepts that we might be able to do really to help with, again, things like food insecurity, housing, some different things that we can partner up to identify people that might be in need. And sometimes it's difficult to reach out. So we have a lot of partnerships. We continue to grow those. We have folks that are in our department whose job is to do that and have that outreach and make those connections. But everything, all politics is local. Really, all health is local too. And you have to have people in the community motivated, and they're going to be motivated by things that matter to them. So unless you have that identification, you have those partnerships, you're not going to be successful really in getting those things done.
And there are already initiatives underway that describe are delivering a lot of what you just described.
Yes.
That addressing food insecurity. So my point to the audience is there are immediate opportunities for you, if you're interested, to get involved.
Oh yeah.
Already, your local county health councils would be a big place to do that, and public health is required to do an assessment of its local community.
Well, and often, too, I think people forget really the power of being engaged, even politically. I think, I've served in the legislature for 8 years and bring that perspective and know what legislators who, are expected to know a lot about a lot of different topics, and they can't know all those things. So they often rely on experts or people that they trust in their communities for the advice on what to do. If there's no relationship, there's no trust. Mm-hmm. And so if you're just a random person who comes in and yells and says, you should do this, you're this or that, they get blocked. They're not going to listen to those folks. But if you can establish relationships with your local officials, state officials. Go to the events that they're at. Go and speak with them. Have a meeting and say these are things that matter in our community. And they develop a trust factor. They'll listen and they'll come and ask that advice from folks. And so just even going to local commission meetings in your county and be able to say, this is something that really matters. Here's a problem. We'd like to fix this. Here's what our solution would be. And ask for meetings and discussions. And there's obviously political and fiscal realities on some of those things. But the more we can talk and share and tell stories and meet with folks that represent us, I think if they feel a connection there, they're more apt to follow suit and try to implement some of the ideas and things that we have, or make investments where we can have those kinds of outcomes that we desire.
As we all experienced the COVID epidemic, there were a number of, actually I think total of 6 federally funded initiatives that came out, federal legislation, totaling about $4 trillion. From the first 4, Tennessee got $25 billion. And generally less restrictions than previously with other government funding than you'd usually find. Tennessee, I want you to talk a little bit, if you don't mind, about what Tennessee's done with that money and how we intend to kind of use it as a foundation for public health in the future as well.
Sure. So a lot of that money went to local governments first and foremost. So a lot of our local counties and commissions have a lot of those funds, and they've used it for lots of different infrastructure. So there was really, with a lot of the money that came in, there was an opportunity for infrastructure investments. There's always a debate when it comes to state politics, local politics. Do you use one-time monies for recurring expenses or for one-time funds and for one-time investments? I'm of the philosophy, if you don't have recurring source of funds, you don't kind of add you don't put something on a credit card thinking, hey, I'm going to have money coming in to make that payment. You don't do that. You use a one-time investment for long-term benefits. And so the state, I think, here has done that, and we've invested in things like our state lab, which needed to be overhauled. We have a brand new state lab that's coming. We've made investments for right now, at least for the next 5 years, into some opportunities to be able to produce more dentists in our state, which we have a huge need for dental care and an opportunity for more residency positions, dental positions, be able to have them rotate through health departments, more dental hygienists, assistants, that sort of thing. There's a lot of money we put into something. We just put the grants out for healthcare resiliency programs, where we've opened up a grant possibility of one-time grants for all of our hospitals, our nursing homes, for infrastructure needs, so that they could use to help fix their facilities up and try to modernize them. And there were competitive grants, so they had to apply. And then also some for innovation kind of concepts. And we had a huge amount of applications for that. We've distributed a lot of funds, a lot of really cool and neat ideas of things that will hopefully help and help in their communities. They had some matches associated with that, but a lot of hospital systems and things. We put out, I think, $225 million total towards those programs. We've also used a lot of the money to help upgrade our local health departments. So many of our health departments, some of them were built in the 1940s, 1950s, and they're patching things here and there. They have leaky roofs. They have different problems. We've been able to invest a lot of money into repairing those things, upgrading HVAC systems, maybe expanding some of those facilities to provide more clinical care, to provide community resources. So a lot of funds were put into that. And of course, a lot of the money that we received from that went towards the COVID fight, towards protective equipment, towards vaccines, towards a lot of things that we needed, really personnel, to be able to expand our resources quickly to hire folks. So as that money starts to recede back, we're going to start seeing probably some contraction of the Department of Health potentially in that regard. But we've got a lot of good infrastructure programs, and we still have some funds available that if we don't use them, they're going to go back to the federal government. So if there's a need or something that we think we can make a one-time investment for long-term benefits, we're kind of still brainstorming and exploring around those ideas. I mean, there's still a lot of needs. Even right now, I think it's, we haven't invested as much into public health over the years, and we knew that there were a lot of cracks and strains when the pandemic hit. It kind of exposed a lot of that. And so the system ruptured in different locations, and we're trying to now look at investing in that to handle the next potential pandemic. God forbid there is another one, but to handle the next emergency that might come down the pike, so that we're ready for that. And so I think there's been a lot of thought put into it of how do we what do we do now to improve that? There's a lot of work groups that have come out of this too that don't require monetary investment, but just things like workforce. How are we going to handle those needs in the future, and are we ready for the next big pandemic? So again, a lot of investments that have been made in infrastructure, and again, there's still an opportunity for the next couple of years to potentially even have some more. So we're still contemplating some different thoughts on that.
Just to emphasize something that you mentioned, $4 trillion sounds like a lot of money, and it certainly is. But when you consider, in the $25 billion that came to Tennessee, when you consider nationwide that, and in Tennessee, as a matter of fact, that we may be spending more money, just as Dr. Alvarado just described, than we were 10 years ago. We're almost to the level that we were spending 20 years ago, adjusted for inflation. So again, to reemphasize what he just mentioned about the perfect storm that occurred during the pandemic, we were kind of ill-prepared just because of lack of resources. And if anybody has seen our emergency preparedness groups and the response personnel, we have got some terrific, unbelievable individuals who are always, there at the ready for us. I think as things start to change in our world, we need to recognize that there's only so much they can do with the current level of resources. And that this is something that this big investment that you just described will certainly springboard us into future, strengthening the system in the future. Yeah,
and what I talk about and what I plan to, my messaging really to our legislature, hopefully to the governor's office, we rank 43rd, overall in public health in Tennessee. Again, a lot of pride. We like our sports in Tennessee. We like our programs that do well. We want to be top dog in those things. We're at one of the top 3 states economically, I would argue, and our legislators often are very proud of that. They've done a lot of good work. There's a reason why this state, people are moving to the state. It's exploding. It's growing quickly. But we've made a lot of investments in tourism. We're ranked, I think, 12th now. We've made a lot of investments in our proper tax structure and in business, structures. People are coming into the state because of all those things that are there. But one last economic pillar is going to be your public health pillar. And when people come in to invest, they come to start a company or a business, they look at the health of their workforce. Are they healthy? Are they going to miss work because they're unhealthy? Is my health insurance cost going to be higher because they're unhealthy? What are our cancer rates, our tobacco rates, our obesity rates? All those things become part of the factors that new companies look at economically. So the last pillar of economic investment that we have to make us a top 10 overall state, which we're not, is that public health. That's kind of the anchor that's holding the state back, is the way I put it. And so we have to make investments in that. And it's tough because the investments that you make in public health are not immediate. It's not like you could put something in the stock market and I get a 12% return at the end of the year. Some of these things take a long time. They may take a generation to feel the impact. There are states that have done that years ago and have seen those results. But it's tougher because I think as Americans, we're used to having things right now. We want the results right now. You have to be willing to put this investment in and then realize you're going to see it down the line. And so we've been asking some of that. I think in my first few months for some investments from the General Assembly. They've responded. Some things that, and again, those are some funds that have been taken away by the federal government or funds that we've said we can probably use better. They've been willing to invest in those things. We're hoping to be good stewards of that, show results, and that will hopefully help build more confidence that we can say, hey, we want to ask for bigger amounts of money to make bigger investments in other things. And again, we've got some concepts on some of that here moving forward too. But yeah, I think there's just a huge need right now. We realize that we've got to do better in that regard, and Tennessee can be a top 10 state in that regard. We just got to put our minds to it. And it's going to take some work, so we're ready to do it.
Well, let's talk a little bit about the human component, the workforce development piece. We were expecting in public health a wave of retirements anyway, and this was before the pandemic hit. And then with the stress and the burnout, and we had just many people leave the field. At the same time, we've got a lot of students going into college, particularly undergraduate programs, that are looking at public health. So that's a good thing. Yeah. And Tennessee has the benefit of having a number of great across the state, university and college-based public health programs. Mm-hmm. So talk a little bit about workforce development and your plans for the department, and then the other public health entities beyond that?
So a lot of things on that. First of all, I think it's a lot of our young people and people going through medical school, nursing school, don't know what the Department of Health does. They don't rotate. I've had a chance to speak to some of the brass within the University of Tennessee, at least, and express that concern. And they've taken that down and said, we probably can do something about that. And I said, just give us a couple of weeks to have med students or residents rotate through a health department to see what we do and to interact. When I trained I did internal medicine and pediatrics. When I did my pediatric training, they made me go to the schools to sit in classrooms and watch young students come in to see the effects of ADHD medications on those kids, because we would prescribe it to see how they would behave before and their medicine had been given, and watch the medicine take effect, and suddenly kids focus better. So getting that exposure helped. I always think about that when I used to prescribe those medicines, and for kids that needed those things. The same thing needs to happen within the Department of Health. We have to have exposure to our medical providers so that they know what's going on there. And I think as they get exposed to that, our dentists, we've made those investments now too, they're going to say, I like this. I think it's, I tell everybody there's a bucket that we have in our souls that gets filled up when we do something good for somebody. And you get more of that. When you're in the private sector, it can be tough. People will complain. There's a lot of negativity that can happen, and it drains very quickly. And people often will seek, the way they fill that bucket, they go do a mission trip overseas. They'll go to a country that's poor. They don't have to do any paperwork, no insurance issues, none of those headaches, to go provide care for someone for free. And that person's gratitude fills that up, and they think, man, I've accomplished something great. And that lasts for a little while. You could find that on a daily basis in the Department of Health. And so I tell a lot of folks, if they come and work for us, yes, it's government. Yes, you have a little bit of bureaucracy that goes with it. But the General Assembly's made a big investment in state employees here in the last few years. They put a lot of money in. That went a long way, really, for our ground level people that do work every day, that greet you at a health department, a lot of the staff that are there. So that's made things better, because now we're trying to compete a bit with the private sector to keep a lot of our folks. But again, people that come and work for us leave often will say, hey, is that opening still? I want to come back and work, because they miss it. And there's just a certain mission that drives you that I think fills people up, and a certain satisfaction that you can't find anywhere else. So we try to sell that. That's one thing I try to, and unless they experience it, they won't know it. Again, I was never a doc in a public health setting, although I would do a lot of things that required prevention, that I often relied on my health department as a provider to provide services of some sort. I had somebody with rabies or say rabies exposure. I didn't carry rabies vaccinations, the immunoglobulin, but I have to send them to the health department to get that. And then we would talk back and forth, and I realized the difficulties they had with someone who wasn't insured or had a problem, and how we could try to work together to navigate it for my patient to get what they needed. So you learn the value of that, but if you're not around that a lot, you don't know. So I think we need to expose more folks really to that. And I've talked to our universities about trying to get that done too. There's also we're working in a lot of work groups right now trying to address this issue. A lot of committees are meeting, talking about what we can do to help improve that. There are groups that are out there that have been working in this that I think we're trying to find to come in and educate from a college level, even in a high school level, to start letting people know about these kind of tracks of what you can do for a living and to find some mission and purpose. And if kids and young people can get exposed to that, they'll find it. You'll find that next generation that's willing to do it. I think as in healthcare and in public health, we've often relied on the goodwill of a lot of people to fill in the gaps of what's wrong. I mean, as a doctor, if something wasn't being done, or it was always the doctor, all you have to do is, those are the worst words, because you knew it was just something else I had to do in a visit I wasn't going to get reimbursed for. But when something went wrong, someone said, but you took an oath or you did this, and okay, fine. And you just kind of put it on your back and you did it again. I think the pandemic got to the point where everybody's back broke, and I think a lot of folks said, I'm done, no more. I mean, they've kind of exhausted the goodwill. And it was always underfunded, and it's just like, just please do an extra thing just for the sake of the community, and people did it. But now you've kind of exhausted that, and so folks are done. They said, I'm hitting the eject button. I'm going to do something else. I'm retiring, no more. And so you've got a big gap and a hole in that we've got to find a way to fill. So we're hoping we can, again, rejuvenate folks to realize the purpose of what we do, the mission of what we do, the satisfaction of what you do, and if people experience it, they'll want more. It's addictive once you get into it. It's hard to describe unless you've experienced it, but once people get into it, they're serving other people. You're really a public servant, and the benefit when you help a family, that emotion, that joy you feel, it's hard to find anyplace else. And so if you want to find happiness and joy in your job again, public health is a great place to find it. But in general, it's just I think it's just, and again, it's just you have to find that gratitude level from people. I think when you hear it from folks. So I always encourage anybody, if you haven't visited a health department, if you just pop in and thank folks, that goes a long way. Just a thank you, because they find meaning in that. And a lot of these people are people that don't seek that. They don't go out and ask for recognition. They don't. They're just quiet about it. They go about their jobs. They do the right thing in tough environments. They're very resilient, and they learn to do those things. I think we just have to sell that, I think, for folks that they get exposed to it. So that's the hard part. It's a bit of a sales pitch. It's I consider that part of my duties to let people know they can find a lot of satisfaction. So.
Well, and I appreciate that. And that's part of the purpose for this podcast series as well, is to help people understand public health better. All of these folks you described, they're not out there tooting their own horn. They're not out there sharing their expertise, often because they've got their nose to the grindstone and they're delivering the service and care to the community. But hopefully, thanks to you and others that we'll have as guests on our series, we'll be able to illuminate that and help them gain the respect that they're due. Yeah. We need them. They're very foundational. In closing, what would you like to see or hope that the audience gains from this in terms of whether it be an increased in participation in public health or use of services, or just becoming a better informed voter about public health issues?
Yeah, so I think I've heard from a lot of my health departments when I've gone and spoken to all the staff. Their comment is, we need better advertising. That's what they tell me. And they say people don't know what we do. And when folks come in here, they don't realize this. And if they knew more, they'd come and see us. And so I think there's a desire for that. And so I would hope that if people hear this, is that they can share this. If they're willing to talk about it more, to engage in conversations with legislators and with local officials more. All that's going to help. And just to remember that a lot of healthcare and public health issues really, in my opinion, is always nonpartisan space. One of the reputations I earned as a legislator, people liked my committee. They liked tuning in. A lot of legislators didn't like serving on it because it was complicated issues, very long stories. For me, the time went by very quickly. I needed more time to go through more of this stuff because it's what I live, it's what I know, it's my passion. But for a lot of legislators, it was just so much information there. But people that did tune in, they said we enjoyed it. Why? Because it wasn't really red or blue. It wasn't political. It was just policy discussion. Where's the priority? Yes, we all want all these things done, but which one needs to come first? The debates were on that. Where do we use money? Were there abuses in the system we needed to fix? So it was always informational in that. And just to remember that this space it's supposed to be really apolitical. So just to kind of remember the policies of needs we have for the community and to convey that and to let people know. So I think it's more of an awareness thing is what I'd like to see happen, is that people become aware of what we do, to promote that, to understand the need for it, and to, how important this is really in the link of what state government does and what our society needs. It's a crucial link, and we touch everybody. Sometimes people don't like that, but it's a reality. And ultimately, we want to be able to motivate folks to achieve the outcomes that we need. And I tell the story because it's true. It was kind of, this is years ago when I was in my practice. I had a 60-year-old, and I think I told you this story. I had a 60-year-old guy that used to come in to see me all the time, and was a smoker, had emphysema. And every time I'd see him, I'd say, man, you got to quit smoking. You're almost on oxygen. You're getting sick. You're too young for this. And I get on his case. And, yeah, doc, I know. This is your job. I know. I've tried a bunch of times. I can't quit, Just give me my inhalers. I'll be fine. And he would blow me off. And I would do the typical thing. I'd offer resources, medications, patches for nicotine, all kinds of stuff. I saw his 5-year-old granddaughter. She was a patient there in my office too, and I remember seeing her for her school physical for kindergarten. And I tell people it was probably a HIPAA violation, but I did it anyway. In a small community, everybody knows each other. And I told her, hey, who I saw a couple weeks ago was your papa on here. He's starting to get sick. You could really help if you could ask him to quit smoking. And I guess it scared her enough that she had a conversation. When I saw him the next time, 4 months later, he had come in, he had quit smoking for 3 months. I said, man, that's great. So what worked? Well, my 5-year-old granddaughter came to me and she was worried about me, thought I was going to die. And so I asked me to quit smoking. So I did it for her. And I thought, okay, so all of my education, all of my educational materials, all of my charm and persuasion, his own health, his longevity, his wife, his kids, none of that mattered. It was a 5-year-old granddaughter that was his motivation, that had him wrapped around her finger. And that exists for everybody when it comes to public health outcomes. And again, I can come in with my wagging my finger saying, you need to. People will reject that. It was someone else that they cared about, or something else that they cared about that was worth quitting or making the change in their health outcomes. We've got to find that, whether it be our state, our community, it's as small as neighborhoods, if you want, within a church, different things, different groups that can rally around a cause that they all would agree on to improve that. And we've got to find that motivating factor. And so the more that we can promote, again, our ideas, our concepts to do that, I think is going to help move the state. Because really my objective is to get this state from where it's at as a bottom 10 ranking to a top 10 ranking when it comes to public health, and to a place where we can point towards ideas and concepts that are going to make this the best place to live in the country, which I think it is right now. I think people are moving here. I've moved here. People have come here. They're figuring that out really quickly. But to add health is one of those things. Saying, boy, they're a really healthy state, and make that a motivating factor to do that as well. So the more awareness, the more discussion, and sharing ideas and stories is the way to get that done. And this is the beginning of hopefully a series of stories you'll tell on these podcasts to get things motivated.
Well, thank you, Dr. Alvarado. You've certainly set the stage for us to have these kinds of conversations, and I'm grateful for that. And I encourage everyone to do exactly as you just mentioned. Please get out, get involved, become aware, and share your ideas, share your issues, and make the Tennessee much better as a consequence. In closing, I'd like to recognize the Sumner County Health Department, which and the county director, Hal Hendricks, was gracious enough to let us record our podcast today. The backdrop, as Dr. Alvarado mentioned earlier, is this. I'm in front of the slow and go. Yeah. But these are just displays that they use for public school students to come in and learn about nutrition, how to read labels and make good food choices. They also have a community garden, back to Dr. Alvarado's point earlier about increasing access to fresh, healthy foods. They also have a garden here that they have opened up to the public and will allow you to take any kind of fruit or vegetable you need that they've grown, of course. So in closing, thank you again. We could not have had a better guest to set the stage for public health, and we are all in support of your efforts and look forward to really having some great conclusions to all of your ideas.
Thanks. Here's a hope, and if they let me do them, I'm going to get them done. So we're ready for it.
Great. Thank you.
Thank you.